I'm an obstetric and gynecology at University Bali, Indonesia. Today I will present my research about delivery characteristic of patient with placenta previa at Sanglah Hospital, Denpasar period 1 January 2019 until 31 December 2019. Introduce the main cause of antepartum bleeding are placenta previa and placenta abruption. Placenta previa is the term used to describe the implant placenta covering the birth canal, one of the most serious complications during pregnancy and is associated with a variety of maternal and fetal-neonatal complications. Global prevalence of placenta previa in 5 of 2 per 1,000 pregnant women, and at Asian continent left past 2 per 1,000 pregnancy, and incidence of placenta previa 0.15% shows obstetric complication with a high case fatality rate. Placenta previa is a significant factor affecting maternal neonatal morbidity and mortality from bleeding, anemia, sepsis, placenta creta, emergency hysterectomy, thrombophlebitis. Global mortality accounts for 30% of maternal death in Asia due to bleeding, placenta previa, massive obstetric hemorrhage. Significant maternal morbidity has also been reported from increased incidence of fetal malpresentation, cesarean section, increased blood loss, peripartum hysterectomy, prolonged maternal hospitalization, and preterm birth. Globally, 3 million neonatal have been reported, and one of the causes of neonatal mortality is placenta previa. From risk factor, egg multiparity, pregnancy, history of cesarean section, history of uterine surgery, history of using assisted reproduction, smoking, use addictive substance, history of maternal recent illness. From neonatal outcome, small gestational egg, low birth weight, with Apgar score under 7 in the first 5 minutes, increased risk of the NICU hospitalized, stillbirth, respiratory distress syndrome, congenital anomaly, intrauterine growth, neonatal jaundice, and hypothermia. From method design a retrospective descriptive study using secondary data with location obstetric emergency room, Polyclinic obstetric and medical record installation of Sanglah Hospital Denpasar with time 1 January 2018 until December 31, 2019. All placenta previa patients who gave with the record in the obstetric emergency birth register book and scheduled elective surgery at the Polyclinic obstetric RSUP Sanglah Denpasar in the period 1 January until 31 December 2019. From result retrospective descriptive studies concludes that Sanglah Hospital Denpasar by using secondary total of 50 samples with complete medical record will include the study. Retrospective descriptive studies conducted at the Sanglah General Hospital Denpasar by using secondary total of 50 samples with complete medical record were in the study. From result characteristic of placenta and fetal position with type previa totalis and marginalis, from placenta position anterior and posterior, fetal position abnormalis with horizontal and bridge. From maternal outcome characteristic from treatment elective cesarean section, cesarean Situ and green coat cesarean section durante of bleeding under 2000 million 1000 until 2500 million and over 2500 with blood transfusion or yes or no. Length of treatment under 4 days, 5 until 6 days, and over 7 days, and with intensive room use or and organ demands. Mater- Maternal outcome characteristic from laparotomy and death case. Distribution of bleeding during surgery and transmission and length of the stay in the intensive care unit based on the type of action. Characteristics of infant outcome. The result from Apgar score and distribution based on the type of treatment. From this discussion, the incidence of the placenta previa from this study was 2 over 63%. From global, 5 over 2% with the highest rate found in Asian race. This trend of increased incidence may be due to an increase the number of cesarean section and older mothers in the first pregnancy. In addition, of other factor may also be due to the fact that most cases of complicated pregnancy are referred to RSP Sanglah Denpasar. In this study, it was found that the large percentage of the sample was more than or equal to 35 years. Extensive placental infraction in the older pregnancy woman to maintain optimal interplacental blood flow. Large area in recurrent for the placental implantation site. Most of the study sample were not mothers with a multigravida pregnancy, 92%. Change in the intermittent vascularization lead to descriptive perfusion of the placenta and increase likelihood of placenta implantation in the lower segment. A large placenta also increases the risk of the expanding placenta implantation to the lower uterine segment as the patient with the multiple pregnancy. Most of the sample gestation age range from to 28 to 36 weeks. Most of those cases were pregnancy women with the placenta previa totalis 94%. Most of the sample had the placenta in a posterior position, 64%. It is a short representation placenta previa totalis then placenta previa partial and marginal from physical examination or ultrasound. Placenta tissue developed more easily of the posterior uterine wall in the placenta previa. Several studies suggest the location of the placenta in the anterior position increase in the incidence of massive bleeding and massive transfusion and placenta accreta and hysterectomy. Fetal defects were found in the 10 of 50 sample with 20% of the which the 6 cases were transfers and 4 cases were bridged. Placenta previa triggers of position abnormality with a higher feeding at the latent position. Fetal defect in placenta previa patient occur because the abnormal placenta of the placenta can prevent the fetus from occupying in the ideal position in the uterus. Of the 50 cesarean section performed, the total variant of the bleeding during the operation was ranged from the 300 until 5,000 milliliter. Most of the sample did not require blood transfusion, 60%. Most of the patient, 76% were treated for under 4 days. Most of the patients did not require intensive care, 76%. Most of the sample had no other organ injury during surgery, 94%. Bladder injury usually occurs upon reliving the extension between the uterus and the bladder, especially in patients with placenta previa or patients with a previous history of cesarean section. Injury to ureter can occur during a hysterectomy when massive adhesion or bleeding make difficult for the operator to identify the ureter. Most of the babies 64 were born with the big range of the 2,500 until 3,990 gram. More of the patients underwent laparotomy in this study and no sample did the study. Most of the baby 64 were born with the weight range 2,500. Most of the babies were born vigorous 70%. Meanwhile, 5 others were born with moderate asphyxia 12% and 6 with the severe asphyxia 13% with the 5 baby dying in the war. Conclusion in the Placenta Previa at Sanglah Hospital was to over 63% the number of mother egg for 30 years follow the most the characteristic multigravidas 92% non-referral 68% the weight of the gestation to until 36 weeks on no history of curettage 68% and with the history of sterilization previous sterilization 58%, a history recurrent bleeding 12% and history of placenta previa in previous pregnancy 24%. Most of the placenta was placenta previa totalis 94% with the posterior placenta 64% and without fetal location abnormalities 80%. Maternal outcome characteristic most undergoing with emergency cesarean section 48% bleeding under 1,000 million 56% no need for blood transfusion 16% duration of treatment under 4 days 76 no need for the intensive care 76% no other again injury 94% no need for laparotomy 100% and no one die. Thank you.